Hello, my dear fellows and professors online. My name is Yuanqi Zhang. I come from mainland China, and it's my great honor to introduce the strategies for the selection of oncoplasty techniques in the treatment of early-stage breast cancer patients. I am from the Department of Breast Surgery affiliated hospital of Guangdong Medical University of China. As we know, breast cancer is a highly prevalent female malignancy in China, affecting about 280,000 women annually. Breast cancer occurs most commonly in women aged 45 to 55 years old in China, and it has a serious impact on a woman's career and their life quality. With the improvements in breast ultrasound examination by hospital, most breast tumors are detected in the early stage, and a 5-year overall survival rate after standard treatment exceeds 80%. As a result, breast cancer patients attach great importance to the effective effect of the breast after surgery. And several studies have shown no significant difference in overall survival, disease-free survival, local recurrence rate, distant metastasis rate, and overall efficacy between breast-conserving surgery and radical breast cancer treatment. However, studies have shown that about 20 to 30% of patients who underwent traditional breast conservation had poor cosmetic results due to the absorption of the serum in the tumor cavity or post-operative radiotherapy, resulting in breast deformities. In fact, some patients refuse the breast conservation because they cannot obtain satisfactory cosmetic outcomes due to the small breast size and large tumor size or tumor location restrictions. Oncoplastic breast surgery is a novel approach to breast conservation surgery, and we call the oncoplastic breast surgery OBS, that combines the effective concepts of breast surgery with the radical concepts of oncological surgery. Unfortunately, lots of breast treatment centers do not promote this technique. The purpose of our research is to explore the selection of appropriate OBS techniques to repair the defects after breast tumor resection in different locations, including the choice of surgical incision and the use of nearby glands to repair the defects. Glandular excision less than 20%. If the mass is small and the removal of a small amount of the mammogram has little effect on the post-operative breast appearance, a radial or curved incision can be made in the skin above the tumor. Surgeons can pull the adjacent glands closer and sew them together to reshape the breast without the need for OBS techniques. However, some studies indicate that because the volume of the removed gland is relatively small, not suturing the adjacent mammary gland may guarantee a satisfactory breast appearance. But unfortunately, the long-term cosmetic benefits of this method have not been proven. The removal of up to 20 to 50% of breast gland, along with the need to remove some of the skin, can cause significant deformities in the appearance of the breast. Restoring the appearance of the breast is a challenge for every breast surgeon. Oncoplasty breast surgery can be divided into the volume displacement method and the volume replacement method. For glandular defects of 20 to 50%, volumetric transfer is the most common method, and if volumetric transfer is not possible, then volumetric substitution is preferred. Now let me introduce the volume displacement method. And the first, racket shape oncoplasty breast conservation method. The racket shape oncoplasty breast conservation method is suitable for tumors located at the same level of the nipple in the lateral and upper outer quadrant, mainly to avoid the nipple areolar complex from tilting outward and upward. And the second one, J-shape oncoplasty breast conservation method. The J-shape oncoplasty breast conservation method is suitable for tumors located below the level of the nipple. This approach was pioneered by Yasuhiro in 1996 and has the advantage of preventing deformities in the outer lower quadrant. And the third one, inverted T-shape oncoplasty breast conservation method. The inverted T-shape oncoplasty breast conservation method is suitable for tumors located in the upper or lower pole of the nipple areolar complex with the breast ptosis. This method was first proposed by Klaus in 1990s and has the advantage of preventing a beak-like deformity of the breast due to skin wrinkling and downward displacement of the nipple areolar complex. And the fourth method, Z-shape oncoplasty breast conservation method. The Z-shape oncoplasty breast conservation method is suitable for tumors located at 6 o'clock with flattened or minorly sagging breast. And the fifth one, we call AT-shape oncoplasty breast conservation method. The AT-shape oncoplasty breast conservation method is suitable for plastic breast conservation in cases where the tumor is located in the lower or outer lower quadrant of the breast. And the sixth one, omega-shape oncoplasty breast conservation method. The omega-shape oncoplasty breast conservation method is suitable when the tumor is located in the upper pole of the nipple areolar complex. In the year 2005, Anderson and his colleagues were the first to report an omega-shape breast conserving procedure with the main advantage of lifting the gland below the tumor to repair the upper pole of the defect, thereby improving the post-operative sagging of the breast. And seventh one, double ring shape oncoplasty breast conservation method. The double ring shape oncoplasty breast conservation method is suitable for tumors located next to the areola with mild sagging of the breast. This method was first reported by Benari and colleagues in 1990 and has the main advantage of preventing displacement of the nipple areolar complex. And the eighth one, V-shape oncoplasty breast conservation method. When the tumor is located below the level of the nipple, especially in the lower inner quadrant, The V-shaped oncoplastic breast conservation method is better. And now I just to introduce the next method we call volume replacement method. According to the Chinese expert consensus on treatment of breast conservation 2020 version, volume replacement techniques, mainly adjacent flap transfer and distal flap transfer, are recommended when local soft tissue repair of V adjacent gland repair after mastectomy of the cancer site could create a deformity such as breast depression. And the first one is application of lateral thoracic vascular perforator flap. The lateral thoracic vascular perforator flap, intercostal vascular perforator flap, and the dorsal thoracic vascular perforator flap can be used for the repair of larger defects after mastectomy. These flaps are particularly suitable for plastic repair, where the tumor is located laterally and superiorly, but only for the repair of smaller breast defects. And the second one is application of the greater omentum. As we know, the large omentum is rich in blood vessels and lymphatic vessels, and its rich blood flow gives rise to its strong absorption and the anti-inflammatory function, which can reduce the incidence of subcutaneous seroma and result in a soft enough feel and fast post-operative recovery. However, due to its limited tissue volume, it is not suitable for repair of larger breast defect. And the third one of the volume replacement method is the application of the mini latissimus dorsi flap. The anatomical position of the thoracodorsal artery of the latissimus dorsi flap is constant, which has the advantages of a long vascular tip, thick vascular tip caliber, and high flap viability. In addition, the latissimus dorsi flap can be cut into a wide flap area, and the donor area can be directly pulled together and sutured, resulting in little influence on upper limb function. Furthermore, it can be used for breast defect repair in any quadrant and is most commonly used for breast repair with large defects. OBS technique is a superior method for the treatment of patients with clinical stage 1 and stage 2 breast cancer because it avoids total mastectomy and guarantees a thorough radical tumor treatment and post-operative cosmetic breast effect. In 2014, a study compared and analyzed the post-operative cosmetic effects of oncoplastic breast surgery and non-oncoplastic breast surgery in the patients with early stage breast cancer. The excellent and good rate of breast cosmetic effect evaluation in oncoplastic breast surgery group was 86.8%, while that in non-oncoplastic breast surgery group was 67.2%. The total satisfaction rate of oncoplastic group was up to 92.5%, and that of the non-oncoplastic group was just 80.2%. The difference between the two groups was statistically significant Moreover, reports have shown that compared with modified radical surgery, oncoplastic breast surgery has a significant relieving effect on postoperative depression, and oncoplastic breast surgery has a very important positive impact on postoperative self-esteem of patients. In traditional surgical procedures, women who underwent mastectomies perceive themselves as incomplete. What's more, women's sense of self-identity plummeted in response to the side effects of chemotherapy. As a result, they will have less contact with the outside world and even has suicidal thoughts. In conclusion, OBS is a superior treatment modality for early-stage breast cancer because it can remove the cancer lesion while obtaining satisfactory breast shape and reduce post-operative psychological trauma and improve the quality of life of the patients. And that's all my presentations. Thank you very much for your listening.